Hey everyone, Dr. Alex Ritza here, and today's video we're going to be talking about our move prep. And you don't care about my move, but what we're going to talk about is why most patients in the office get back pain, similar to what we talked about in our last video. And we're going to talk about how it applies to lifting, whether we're talking about lifting something in the gym or whether we're talking about moving. So invariably, when somebody is going through a move, especially in the spring, we usually see a lot of cases of lower back pain. And whether it is somebody that's lifting for a move or somebody that's going back to the gym or new to the gym or has a gym injury, usually the mechanism of injury is the same, and it's usually one of two things. One of the reasons they might have pain is because one of the following. So either that when they were lifting, they were using their back muscles too much to do the lift instead of using their hips or their glutes, and that stresses or strains the low back muscles, and that creates some tightness or some spasm and then eventually some pain. So I would categorize this issue or this injury or this problem, however you want to articulate it, as more of a muscle issue. Now that muscle issue will affect the spine, it will affect the joints, and that all needs to be corrected and fixed. Now that is the lesser injury. And so if you want to avoid that one, that's where we talk about, instead of, people always say lift with your knees, but you really want to lift with your butt or your glutes. Like we talked about in our last video, we talked about a lot of low back pain comes from using the smaller muscles of the spine instead of the bigger muscles in the buttock. So if you lift with a curved spine and use your back, that's going to use the back muscles, as opposed to when you bring the hips back, squat down, and you lift with the legs. When it comes to, say, moving a box, this is where we want to squat down, get nice and low, and we want to push up through the feet using our butt. And in this position, you're still going to have some strain on the low back, but the more that you can squeeze the glutes, keep the box close to you, try not to overextend the back, that is going to minimize the amount of strain on your spine. The further away the box gets, you can already feel it on those low back muscles. So when we're lowering too, squat down, box is gone. So in that case, there's a couple of things I'm thinking about. I'm thinking about squeezing the glutes, and I'm really thinking about contracting my abdominals and keeping the core nice and tight and activated. And that's to prevent issue number 2. So issue number 2 is more of we'll call it more of a spine or a joint issue. And it's when you get some instability in the spine. And you can think about it as like the spine joints like bump into one another or literally shift. And then the spine goes into like crisis lockdown mode, where you get pain, you get spasm, you sometimes, if you've actually irritated the tissue, you might get some pain traveling away. And whether you've actually caused an injury with that slight jolt, shift, subluxation, or instability, whether you've caused an injury or you've pushed the body into crisis lockdown mode to try and prevent an injury, this is a more substantial and a more difficult problem, because it's kind of rooted deeper in the spine. And the deeper in the spine, you're going to have more spine involvement, more nerve involvement, more muscle involvement. It's a very lay explanation of it. It's not the most scientific, but that's a good way to think about it. First situation with lifting with the muscles, basically getting a muscle spasm from using the superficial muscles instead of the butt. It's more of like a muscle issue, a spasm. And then the latter problem is if something shifts or you have some instability in the spine, that's from a deeper issue, and it's usually going to be harder to take care of on my end and takes longer to get away. Now, when you talk about back science, the ideal thing would be core nice and tight, and that you only move your hips and that you don't move the trunk, that there's no curving. Now, that's not very practical with a move. Like, you just can't do that if you're lifting awkward things. So you're gonna have to have some parts where your back is in a less than ideal position, But if you can remember to tighten up your core, and just like with tennis, when the tennis players go, they are activating those core muscles. They are causing what's called a Valsalva maneuver. And if you can do that, tighten up on the side, the front, the back, and then do your slightly awkward lift. Of course, trying to use the hips, trying to use the knees, trying to lift with your butt and not your back. That will minimize the risk of injury. And so most people in the gym, when they have a low back issue, it's usually because something gets bumped or they have a lack of focus, or something causes that perturbation or that slight slippage, if you will, and the joints deep in the spine get irritated, and then it goes into crisis lockdown mode. Or if it's lifting and you're just doing too much back extension, not with good technique, not using the glutes, that's going to bring on that first situation. The key is to make sure that when you are lifting, you are trying to use the bigger butt, glute, strong muscles as much as you can. And when you cannot use those, you're going to try to use your core nice and strongly engaged, thinking about it like a big solid rectangle, basically from genitals to the base of the lungs, trying to keep that rectangle straight. But when you have to bend it, make sure that the abdominals are nice and tight, and make sure that you are bracing that core, keeping the spine nice and tight, less chance of having things shift or having things become unstable. So as we're prepping for our move, that's what I'm thinking about. This is something I see almost every day in the office, at least as an explanation for low back pain. So as always, everyone, I hope that's helpful. I hope that keeps you, well, I'm always happy to see people in my office for wellness reasons to keep them functioning optimally or reach a higher level of health. Hopefully that keeps you off of my table screaming in agony. Until next time, guys, take care. Hopefully I'll see you next week after we move in. TBD. Goodbye.